Welcome to this resource on rheumatoid arthritis. We'll cover helpful information you may see on a test, and we have some practice questions at the end. But first, welcome to Artemis Interactive Media. Artemis is your guide to learning resources and continuing education. This quick timeout is a short study break, and we'll cover rheumatoid arthritis. If we need any help, Artemis will be here to guide us. You may also note a clover at the top of this resource to indicate a topic usually covered in med-surg courses, with the color indicating the body system, in this case, musculoskeletal. Rheumatoid arthritis is a chronic autoimmune inflammatory disorder. Unlike osteoarthritis, which is caused by wear and tear, rheumatoid arthritis occurs when the immune system attacks the synovial lining of joints. This can cause pain, swelling, and stiffness. Over time, the inflammation can lead to joint destruction, deformity, and systemic complications. Clients with rheumatoid arthritis commonly report prolonged morning stiffness, lasting more than 30 minutes. Joint involvement is usually symmetrical, meaning both sides of the body are affected. Symptoms may also include fatigue and weakness. Swelling of the joints, warmth, and tenderness are common findings. Some patients may develop rheumatoid nodules. Diagnosis is based on clinical findings, including assessment and history, laboratory testing, and imaging studies. Important laboratory markers include rheumatoid factor, anti-CCP antibodies, ESR, and CRP. Imaging such as X-rays or MRIs may reveal joint inflammation or erosion. Treatment focuses on reducing inflammation, relieving pain, and slowing disease progression. NSAIDs and corticosteroids help manage symptoms, while DMARDs, such as methotrexate, help slow joint damage. Biologic therapies may be prescribed for more severe disease. Lifestyle modification and physical therapy are also important. Clients should understand the importance of medication adherence and monitoring for infection, especially when taking biologics. Joint protection techniques, balancing activity with rest, and recognizing flare symptoms are essential teaching points. To summarize, rheumatoid arthritis is a progressive but manageable chronic autoimmune disease that requires early recognition and treatment. Prompt intervention can reduce joint damage and improve quality of life. A multidisciplinary approach, including medication, rehabilitation, and patient education, leads to the best outcomes. Here are some helpful tips. Patient education that leads to treatment adherence can improve quality of life. Provide for periods of rest as needed because fatigue can worsen symptoms. During flare-ups, maintain joints in the functional position to preserve joint function, and encourage the client to get dressed daily and wear street clothes. Before we test our knowledge, rheumatoid arthritis can be a complicated topic to understand. There are different types of arthritis that require different treatment considerations. The following questions will test our knowledge on the material we covered in this resource. So please answer the following 5 questions to gauge your mastery of this material. But don't worry, if we need any help, Artemis will be here to guide us. Question 1. A nurse is assessing a client with suspected rheumatoid arthritis. Which assessment finding is most characteristic of RA? A. Unilateral joint pain relief by rest. B. Morning stiffness lasting longer than 30 minutes. C. Pain that worsens only after exercise. D. Hard nodules on distal finger joints. And I'm going to say B. Morning stiffness lasting longer than 30 minutes. And we're correct because RA commonly presents with prolonged morning stiffness and symmetrical joint involvement. Before we go on to the next question, let's take another look at option D, hard nodules on distal finger joints. Now, earlier in the resource, we did mention that rheumatoid arthritis can cause nodules under the skin, so why didn't we pick D? Well, it says on distal finger joints. People with osteoarthritis might have bony nodules on distal finger joints, whereas people with rheumatoid arthritis might have arthritis nodes. Those are soft lumps that occur away from the joints. So that was the tricky part of D, is the fact that they specified distal finger joints, which is something we might see with osteoarthritis nodes. Question 2. The nurse understands that rheumatoid arthritis is best described as which type of disorder? A. Degenerative joint disease. B. Metabolic cartilage disease. C. Infectious bone disorder. Or D. Autoimmune inflammatory disorder. I'm going to say D. Autoimmune inflammatory disorder. And Artemis says we're right. RA is an autoimmune disease that causes chronic inflammation of the joints. Thanks, Artemis. Question 3. A client with rheumatoid arthritis reports fatigue and joint swelling. Which additional symptoms should the nurse expect? A. Warm, tender joints. B. Joint stiffness improving immediately upon waking. C. Asymmetrical joint involvement. Or D. Bone fractures without pain. I'm going to say A. Warm, tender joints. And Artemis says we're right. Inflamed joints in RA are often warm, swollen, and tender. Question 4. A nurse is teaching a client newly diagnosed with rheumatoid arthritis about medications. Which medication is considered a disease-modifying anti-rheumatic drug, DMARD? A. Ibuprofen. B. Prednisone. C. Methotrexate. Or C. Acetaminophen. I'm going to say C. Methotrexate. Methotrexate is commonly prescribed DMARD used to slow disease progression. Question 5. A nurse is monitoring a client receiving biologic therapy for rheumatoid arthritis. Which complication is the priority for which to monitor? A. Hyperglycemia. B. Infection. C. Dehydration. Or D. Hearing loss. I'm going to say B. Infection. Biologic agents suppress the immune system, increasing infection risk. Thank you for your attention to this resource presented by Artemis Interactive Media. This presentation may be used for content review and clinical competencies for pre-conference and post-conference education. This quick timeout can also be used for a short study break. Rheumatoid arthritis involves more than this QT covers. For more information on this disorder, please contact your instructor and refer to your textbook. If you would like to review the references used in this resource, you can find them here.